The Department of Radiation Oncology at Sibley is an outstanding clinical care facility that has uniquely blended the clinical excellence of Sibley with the outstanding research and providers that are both at Johns Hopkins in Baltimore and providing care in Washington, D.C. Radiation treatment's 100 years old, and it's drastically evolved with the new technologies that we have. So we're giving patients very, very targeted treatments due to the improvements in the machines and our computers, as well as our training and our clinical care, all combining with our research to provide highly precise, very, very directed radiation. I serve as the Director of Radiation Oncology for the National Capital Region. That encompasses both Sibley and suburban hospitals. At Suburban Hospital, we provide comprehensive stereotactic and head and neck services, as well as treat a variety of cancers, just as we do at Sibley. And at Sibley, we treat both adult and pediatric cancer care patients. This level of excellence for cancer care is unparalleled in the DC region. I know that any patient that I see, I'll be able to talk to the medical oncologist and the surgical oncologist immediately to provide outstanding multidisciplinary care and a truly integrated effort where we communicate about all aspects of that patient's clinical care and the needs of that patient. The Department of Radiation Oncology was the very first department to bridge from the Kimmel Cancer Center to Sibley, and as a result, we were able to open clinical trials to all patients that entered the doors. Cancer care that's provided at Sibley really is an opportunity to enroll in a clinical trial, any trial that's available at Johns Hopkins. Every disease site runs a multidisciplinary tumor board where all of the physicians, regardless of specialty, sit together. That includes medical oncologists, radiation oncologists, surgical oncologists, pathologists, radiologists. We're all together to discuss all the nuances of every aspect of that patient's presentation and disease. We then come together to a consensus to decide what treatment approach to take. We care a lot about community outreach and have opened a clinic in alliance with the United Medical Center that's in Wards 7 and 8 in Washington, D.C., and are providing long-term clinical care for cancer patients in that region. Kids require specialized care and treatment facilities that tailor to them. We now have quality care provided through a collaboration with our partners and our care providers at Children's National Medical Center. Children are enrolled on pediatric cancer clinical trials.
Sarah, they're ready for you on the table.
In general, all kids are enrolled on a clinical trial, and so we need to provide unique services for children. This includes collaborations with the pediatric oncologists for their chemotherapy. It includes specialized and tailored radiation just for kids. It includes anesthesia services that allow them to receive radiation in a very safe and stable fashion.
All right, thumbs up if everything's good, Sarah. All right.
We are all concerned about late effects of treatment. With children especially so, we want to make sure that there's no side effect that could have been prevented. So high quality care is absolutely essential. We're also developing a Proton Therapy Center. That center will specialize and have one dedicated treatment room just for kids. There's a heavy emphasis on pediatric care at Sibley.
So this is the entry tube. As you can see, down here is the pit.
The Proton Center will have 3 additional treatment rooms that will be used for adults, and so adults of all different cancer types will be able to receive treatment. Proton therapy is extremely precise. Proton therapy has the ability to target a tumor and avoid normal tissue much more than standard treatments would. A primary goal of proton therapy is to decrease the late effects of treatment. It's a truly comprehensive unit and facility. Palliative care definitely does not mean hospice care. It means pain management, and adequate pain control is a crucial aspect of any cancer care.
Well, how has it been going in terms of the chemo radiation combination?
We have a focused nurse practitioner at Sibley who sees patients, and she provides outstanding palliative services. She also directly manages the pain prescriptions, and so as a nurse practitioner is available to any patient that's seen at Sibley. Radiation is available to anyone and everyone in the community. And we have a very integrated cancer care program that includes collaboration between radiation oncology and medical oncology as part of the greater Sibley Kimmel Cancer Center. And that bridge means that we're providing outstanding cancer care in the DC region.